Operating Room Technique, ORT. Introduction to the ORT. Operating room or the theater block is one of the important special departments of a hospital. An operating room is a particular room where the surgery and the surgical procedures are conducted. This is where we have to practice a high standard of aseptic techniques and sterilization of supplies in order to reduce the events of infection. Surgery is an invasive method of treatment that may be planned or unplanned, major or minor, and that may involve any body part or system. Surgical procedures require physical and psychosocial adaptations and are stressors for both the patient and the family, no matter what the extent might be. The patient's recovery from a surgical procedure requires skillful and knowledgeable nursing care, whether the surgery is done on an outpatient basis or in the ideal operation room. All phases of the nursing process are used perioperatively to make assessments, arrive at a diagnosis, make appropriate plans, and provide interventions necessary to promote the recovery of health, prevent further injury or illness, and facilitate coping with alterations in physical structure and function. Dear student, let us see. Phases of the perioperative period. A. Preoperative phase. From the time the decision is made for surgical intervention to the transfer of the patient to the operating room. B. Intraoperative phase. From the time the patient is received in the operating room until he is admitted to the recovery room. C. Postoperative phase. From the time of admission to the recovery room to the follow-up home or clinic evaluation. The OR suite is divided into 3 areas that are designated by the physical activities performed in each area. A. Unrestricted area. Street cloths are permitted. A corridor on the periphery accommodates traffic from outside, including patients. This area isolated by doors from the main corridor and from other areas of OR suite. It serves as an outside to inside access area, unrestricted zone, area in the operating room that interfaces with other departments. It includes patient reception area and holding area B. Semi-restricted area traffic is limited to properly attired personnel. Body and head covering are required. This area includes peripheral support areas and access corridors to the operating rooms. The patient may be transferred to a clean inside stretcher on entry to this area. The patient's hair must be covered. Semi-restricted zone, area in the operating room where scrub attire, clothes, is required, may include areas where surgical instruments are processed. C. Restricted area masks are required to supplement surgical attire. Sterile procedures are carried out in this area. The area includes the operation rooms, scrub sink areas, and sub-sterile rooms or clean core areas, where unwrapped supplies are sterilized. Restricted zone, area in the operating room where scrub attire and surgical masks are required, includes operating room and sterile core areas. The operating room areas are as follow. A. The supervisor's office has direct access to the outside of the operating room. The supervisor may need to receive visitors and significant others who are not dressed in scrub attire. B. Dressing room. For operating room personnel, have a door to the outside corridors so that personnel may enter there, change into scrub attire, and go directly into the operating room. C. The holding area. This is the area where the healthcare givers properly identify the patient and make sure that all preoperative cares are carried out and other important data are in the patient's chart. D. Scrub areas are located in several places close the operating suites. Hot and cold water pipeline supplies, scrub brushes, caps, soaps, masks are located at each scrub station. E. Sterilization room. It is adjacent to the operating room. The room is usually equipped with boilers, autoclaves, for providing sterile water for solutions, and also water for the surgeon's hand, and to clean instrument during surgery. The room should be wide enough for lying trolleys comfortable, to reduce humidity, heat, and risk of infection, and it must be well ventilated. F. Utility room is a room where equipment to be cleaned and stored. Here a packing room is attached with it, and if not available, the utility room must be wide enough for dual purpose, that is to prevent contamination and humidity. G. The sterile supply room serves as a supply depot for wrapped sterile articles. This area should be dusted frequently with a damp cloth and have storage cabinets with doors to minimize exposure of the supplies to room air and dust. H. Supply and storage areas is a room where sterile equipment is stored and supplied. Here, Yun Sterile